Now, if we were to put you to the test to see if you could determine the difference between an urgent healthcare need and an emergency health issue, how would you do? Do you think you could identify the injuries, illnesses, aches, and pains that deserve a trip to the emergency room versus those that can be taken care of at urgent care? Well, today, we want to make it crystal clear, and for a good reason. Here to help are the Vice President of Population Health at Peninsula Regional Medical Center, Catherine Fiedler. We also have PRMC's Director of Emergency and Trauma Services, Sarah Arnett, and Washington High School student Brandon Wagner joins us as well. Thank you all three for being here this afternoon. Okay, so Sarah, we're going to start with you. Let's start with a test, and we're going to go over some symptoms, okay, of two actual PRMC patients, and we're going to actually see if our viewers can determine if it should be a trip to the ER or if urgent care is more appropriate. Okay, so the first one is patient X. Wakes up with facial numbness and drooping. There was no injury to the face or head and no dental pain. The patient does not take any daily medications and is experiencing the classic stroke symptoms. Let's go to the next one. Patient Y is in pain and needs a refill of their chronic pain medications. The patient has an appointment with a primary care doctor, but it's 2 days away. There you go. To our viewers, do you know which is the true emergency? Sarah, you'd like to shed some light on it?
Sure. Patient X is the first patient, and she is experiencing, as you said, classic signs and symptoms of a stroke, which can be a life-threatening emergency. There are two kinds of strokes. One is ischemic, where there is reduced blood flow to the brain, and one is called hemorrhagic, where there's actually bleeding in the brain. And both of those types of strokes can cause the symptoms that you described when you were talking about patient X. So that is a life-threatening emergency and would necessitate a trip to the emergency room immediately.
Immediately? Would,
Yes.
I mean, a call to an ambulance
Yes,
even?
absolutely.
Yeah, okay. And then patient Y.
Patient Y has chronic pain, as you mentioned. They do have an appointment with their primary care physician. That is not an emergency condition and could either be addressed at the primary care physician's office in the 2 days with their appointment. They could also present to urgent care, or they could call their physician and see if they can get a sooner appointment, and that's really not a necessitating trip to the ED.
Right, right. So do you see a lot of people unnecessarily utilize the emergency room?
We do. Out of our 92,000 visits last year, approximately 25 to 30% of our patients were classified as urgent, non-urgent, or not emergent at all, which is a tremendous number of patients that take up rooms and resources within our department and cause some backlogs at times.
Yeah, and that can have, I imagine, a snowball effect and can actually affect other people in the hospital, or
It can. It actually impacts more than just the ED. With our X-ray department, with our lab, overwhelming resources outside of the ED can cause a snowball effect as well. And it does take up resources for those patients that are experiencing true medical or traumatic emergencies, and can be a distraction to getting them the care that they need immediately.
Sure, sure. Okay, so is there any tried and true way to determine whether a medical condition is a true emergency?
There are some tried and true things that even a layperson would know right away that's an emergency. There on our website, peninsula.org, there is under the emergency department tab a list of things that are truly emergency conditions. Uncontrolled bleeding, stroke symptoms, symptoms of a heart attack, or any type of emergency behavioral health situation are just a couple of examples.
Yeah, yeah. All right, so Catherine, you're here to talk about something called the SWIFT project. It's something that is helping, right?
It is. So it's very similar. We find that in the community, oftentimes folks don't call 911 for things that are not urgent needs. And so that, as well as in the emergency department, distracts the teams, the emergency professionals, from giving care to those who need it, to those who may not need it emergently. And so what we've done is a partnership with the health department and Salisbury EMT, and we have a paramedic and a nurse practitioner going out and seeing patients in their home proactively. We identify these folks as high utilizers on a list. We run a list every month of folks who have called 911 for these non-emergent needs, and we do outreach. What we find is these folks often just need help with transportation, help getting that primary care visit, and other support services that aren't those emergent needs. So it's already we started about October, about a 62% decrease in these unnecessary calls to 911. So we're pretty excited about the results so far.
Getting out and educating people. Okay,
Yes.
so Brandon, that brings us to you. Tell us more about the project and what you and your fellow students have learned from it.
Well, we've been working on the project since the beginning of the school year. My group consists of Colby Horner, Zoe Nichols, and Lee Beecham, and myself.
Who are in the audience.
Yeah, we've been working on it for a while, and we were just really interested with waiting times in the hospital. And actually, Maryland has the highest waiting time out of any state in the United States, and it's 53 minutes for Maryland, while the nationwide average is 22 minutes. And we were all like interested in this topic, and my mom actually has been an RN in the ER at PRMC for over 13 years, and I know how hard she works and how long the people have to wait in there, so it's really concerning. We teamed up with Miss Kathy at PRMC, and it's just an issue that needs to be addressed.
And you guys actually came up with an innovative way to address the issue?
Yeah, we actually, our goal of this is to make a PSA commercial that'll air on local news stations, so hopefully that'll make people aware of how to use the ER.
Wow. So we've covered a lot in the last few minutes. What is the one thing that you want our viewers to take away from this?
I think from an ER perspective, certainly we will welcome you if you are feeling as though you're having a medical emergency. If you're not medically versed, what may be an emergency to you is not always an emergent situation for us, but we can certainly help you decide that once you get to the hospital and provide you with resources once you get there to help you determine next time if you need to come and see us or whether you can see your doctor. We're happy to educate anyone who has questions. They're welcome to reach out to us at the hospital. We have case managers and social workers that can help as well. So we're always available for questions and provision of resources if people need it.
All right, Sarah, Catherine, Brandon, thank you so much. What a great idea, what a great project, and thanks for coming in and talking about it.